So we'll call the meeting. Roll call.
Okay, Clarence Campbell,
Here.
Richard Huber,
Here.
George Busse,
Here.
Laura Negro. Laura Negro. Dr. Horning. Dr. Horning. Can they hear us?
Here.
Laura Cruz,
Here.
Joy Henderson, here. Dr. Keller,
Here.
Elizabeth Franick,
Here.
That's who that is.
Yeah.
Okay. Public comment, anyone anyone from the public wishing to make comment about anything on the agenda for this meeting? No one in the room, anyone online? Otherwise, we'll move on. Next item is approval of the minutes of the last meeting. It'll be in your packets.
This is Laura Cruz. I have a couple questions.
Okay, go ahead, Lauren.
Do we need to have that the hearing was at the meeting was at the Ashland County Courthouse?
What was it? It
Mhm.
doesn't say it was at the Ashland County Courthouse. Oh. Okay.
yeah, we don't, beyond all the previous minutes we.
Yeah, I don't think we ever list where the meeting is held.
Yeah.
Okay, I wasn't sure. So I was just double checking.
Okay.
I move to approve the minutes.
Bruce, I second. Motion by Laura Cruz, seconded by George to approve the minutes. All in favor signify by saying aye.
Aye.
Anyone opposed? Motion carries. Discussion items, 2024 year-to-date expenditures. Remember, anything on there we need to pay attention to, or?
Honestly, no, it's looking really well. So this is everything through June, so halfway through the year. And seeing like everything kind of being around that 40 to 50%. It's early, but you know, I see that as positive. I didn't have any red flags, for any of the, departments yet. I think that's looking really well so far. Did anybody have any questions on this year to date? Okay.
Okay, then we'll move on to the 2025 budget proposal.
This one's gonna be a little bit different than the one that was uploaded last Friday, so if you guys looked at it online. Dan asked me to remove the BFI grant until we know if we're gonna get it or not. So these are the numbers without that revenue or expense. The main highlights, the increases in cost. The wage and fringe increases. That's the total dollar amount for the whole county. The 205,000. And. Child support, we added 10,000 to that cost. Kelly and I talked about that a couple weeks ago, that was a little bit higher than what was planned, so we increased that. And increased some of the training and travel, because remember last year that by the end of the year, we, that had gone over, so it was too late for me to increase for 2024, so we'll see how that goes, but I did increase it some for 2025. It's not a lot of money, it's, you know, I think we were over by $6,000 last year, so I increased it about 4. Just with the increased travel. Yep.
Yeah, and I did just want to point out, because I know it was a question last time. So even though we put it as a separate line item, most of that training and travel has a revenue that's reflected somewhere else. So most of our programs, if they require us to travel, they'll pay for that.
Yeah.
There are some that don't.
And Liz is a good example even for training, like she had a lot of training, but she had grants that covered that
Mhm.
stuff too, so. So that was just a side note with last year, but I wanted to make sure that I had included more in the expenses, for this upcoming year. There's a lot of unknowns. We don't know the indirect costs yet. Sue thought that Maximus report would be coming in August. I haven't seen it yet, so that could go up or down the indirect costs. And revenue, we don't know a lot about the revenue just yet. Anything that we didn't know, I just used the same numbers as 2024, so those could go up. I don't think anything would go down. I don't foresee that, but which would then reduce the levy amount that we could ask for. Kelly let me know today, they were kind of hoping to get some preliminary numbers maybe next week. So this could change a lot. Like, this changes daily. This is our moving target, but as of this moment, this is where I'm at. And the BFI grant, we could, know, in September, but we might not know until November.
October, November.
Cross your fingers that,
It hasn't been submitted yet. I talked to that, so
okay,
I don't know the turnaround. The first time we did it, they were really late doing it, so we
Okay.
got off to a late start, and that's not uncommon with these grants, but then it is backdated, so.
okay. Well, and what was talked about is if that does come in later after the fact, that we could just do an amended budget and add that the revenue and expenses. The Ignite grant, we're hoping that would go through May of 2025 next year. That'll be ending through there. And then, like I already mentioned, the BFI. If we can get the BFI grant added back in, honestly, that helps. We would lower the levy request by possibility, like up to like 60,000-70,000, because we'd be spreading out those indirect costs. Instead of it getting divided up to less programs, we could divide it up on that, because it's by full-time employees. So when you remove those full-time employees, it ends up adding more cost to the other programs and grants that don't necessarily have the revenue to go with it. So that would be another positive if we can get that grant, and that would adjust this budget to the positive, I feel like.
And just on that note, so hopefully we do get the grant. Pat Kinney has talked to Dan Grady, who said if we do, they'll submit what we have and do a budget amendment as soon as we know. And if it's prior to the budget being approved by the full county board, that'd be great. Otherwise, they'll just do the amendment when we get it.
Does anybody have any questions?
George?
Yeah, I don't think most of us probably don't have much insight as to the county's funding stream at this point. And so I just wanted to make sure that, it would be my understanding you've gone over this with the administrator. And the administrator is comfortable that this would fit within the county's overall budget. Is that correct?
Well, so this is our preliminary one, and then the financial consultants with Dan will go through it with the fine tooth comb. So there will be changes, but right now we've pared it down as much as we think we can, but the financial consultants might also find something.
And then they might change their mind once they see all of the budgets. Not everybody's done with their budget, so I'm sure when Dan can compile it, he did review it, yes. He didn't make any suggestions other than what we talked about with removing that grant. Without him suggesting anything else, I feel he is comfortable with it at this time, but until he sees all of the budgets, it's probably a little early for him to really judge that too, because there's still a lot of, till he could put all the numbers together, which I think he's still gathering from all the other departments.
So you're asking us to approve this as a budget request? Is that the idea?
Asking you to approve it as is currently to be submitted to the full county
Finance committee,
board.
go to the finance committee first.
For the finance
Yeah.
committee, thank you.
And it's a working budget, so if we find out, I think this happens every year, like the one you approve isn't necessarily the final one either, but it'll go to, if we find out from Kelly that she has 20,000 more revenue, we can guarantee that'll get added in, that would lower how much our levy request is. If we find out that, some of the funding, like increase some of our other programs, then I would put that in, so that way we have an accurate budget. So it's a working budget. Because it's only August and sometimes we don't find this stuff out until October. So we do our best to estimate based on previous years, and what we know as of now. So I can guarantee you it will change.
My question is, what are we approving? We don't have the authority to approve a budget, but we have the authority
Right.
to forward this
Approve the
request to
Yeah,
go to
to
the finance committee.
I
and
think
I would
that's,
so
that's what
move.
we're doing.
Oh, okay, yep.
So I would move that we
Approving the-
approve this as a request to go to the finance committee.
Okay, motion by George, is there a second?
I'll second it.
Second by Rich. To approve this budget request and submit it to the finance committee. Any other questions? Otherwise, all in favor signify by saying aye.
Aye.
Hi.
Any opposed? Motion carries. Public health update. Liz.
Hello, everyone. All right, so I do have several updates for you all today. The first one is just kind of a ongoing update. We haven't necessarily touched on recently, but COVID-19, just wanted to touch base on that as far as local testing data and wastewater monitoring continues. So local testing data between that and the wastewater monitoring is showing that cases are continuing to increase both locally and statewide. Current state data actually shows case activity has surpassed the levels that we were at throughout the state as compared to Christmas time, which is usually when we see significant cases of seasonal respiratory viruses. So for it to be this high rate now is off season, pretty significant. So just wanted, for everybody's awareness, please be aware that your summer colds may be more than just colds. Continue to stay home if you are ill, follow appropriate precautions and that sort of thing. There will be a new seasonal COVID-19 booster that will be coming out. We don't have a specific set timeline for when that is coming out yet. We anticipate that it will be sometime in September for the seasonal vaccination series. These doses will be available at local pharmacies and clinics. We will be planning on having a limited supply via the Vaccine for Children and Vaccine for Adult programs. We did not pre-order any private pay COVID vaccines because after the initial wave of vaccinations, we've actually had very few requests for COVID vaccines. So we didn't want to make a significant purchase of private pay vaccine stock and then essentially have to eat that money because if we don't use it, we lose it. So we will be offering the VFC and the VFA only at this time is what the plan is. Also, the state bridge access program for vaccinations has closed at this time. So it will be the Vaccine for Children and Vaccine for Adult availability is what we'll have. Going along the lines of vaccines, flu season is fast approaching. October will be here before we know it. So we are in the initial phases of scheduling our clinics. We plan to do on-site clinics for all of the schools as per usual, as well as the senior meal sites, some of the local businesses that we routinely provide vaccinations for. In reviewing the prices for this year, they will be similar to last year, $35 for the regular strength dose, which is the same as last year. And then we will have to increase the price for the high dose vaccine for those age 65 plus. That will be at $80 this year to cover the cost of the vaccination and the administration fee. In other immunization news, I have a dog chiming in, I apologize. We are beginning work on the RICE grant, which is the Routine Immunization Community Engagement Grant. We've begun work for reminder recalls for children, essentially anyone 18 years and under, who are not currently up to date with recommended or required vaccinations. So this is a very timely grant at this point in time, as the Wisconsin student immunization law has been updated to require the meningococcal vaccination series for children 11 to 12 years of age, as well as at least one dose for those going into their senior year of high school, if they're receiving that dose after 16 years of age. So we will be working and reaching out to the local school districts to offer those vaccinations for those that are eligible through the Vaccine for Children program, and making referrals to local providers for those that would be covered under private pay insurance. We will be at the Ashland area farmers market this weekend with immunization information, as well as emergency preparedness information. We're actually going to be giving out free solar lanterns to assist with those who are looking to start emergency kits for home or their car, whatever the situation would be. And then the final big update that we have is we have received the next round of funding for the public health harm reduction vending machines. There is a very short turnaround time for this grant. The grant period technically started in June, but we weren't awarded until like 2 weeks ago. The end period for the grant is at the end of September. So we have a very short turnaround time to spend $55,000. And I do have a plan in place for that. So hopefully we will be able to expense all of it. We're planning on ordering another vending machine, as well as all of the supplies to stock that machine and the other two. We are still working with Bad River on placing the second machine. We've encountered a few technical difficulties along the way, but we are hoping to have that up and running very soon. I've recently received updates that they are building a freestanding shed to actually house the machine, so it will have some environmental protection, and that is anticipated to be completed by the end of the month. So we are hoping very soon to have that second machine up and running, and with the new grant award, in total we will be looking at having 3 machines within Ashland County. Any questions?
In general,
Go ahead, George.
couple questions in general. I was wondering how we did with the blue-green algae this summer versus prior years. At the beaches.
The Ashland city beaches have had no incidents of blue-green algae blooms reported. We have had 2 blooms reported, one at Day Lake, out of the Clam Lake area. And then the other one, I believe, was at the Butternut Lake, and that was at it was actually a pretty big bloom. And that was located essentially right within one of the DNR run boat landings. So they predominantly handled the signage and posting for that. Being so close to Price County and the general area, Price County actually did do a lot of the notification with that one as well.
I had one other just comment. On September 7th, there's a sort of a nonprofit fair in conjunction with the Ashland Farmers Market. It's by the Methodist Church. They did this last year. Just something that might or might not be an opportunity for us, information wise.
I did hear about that, and I believe CCS was involved with that previously. I know we had a conversation about it, but it was more for the organizations. Maybe a potential, but not for sure. We have to look into it, is the best answer I can give on that one.
So just a point of information. I don't know what the right answer is.
Any other questions for Liz? Anyways, next item is the International Overdose Awareness Week.
And that one is me as well.
You got another
So
one? Oh, no, that's not- no.
International Overdose Awareness Week is August 26th through the 31st, and International Overdose Awareness Day is on August 31st. So the Chequamegon Bay Overdose Awareness Committee has been working with local businesses throughout Ashland, Bad River, Washburn, Bayfield, Red Cliff, Cornucopia, and Madeline Island. And our goal is to essentially light up our communities purple. We will be posting and offering information signs to be posted in the local businesses that are participating, along with the storefronts illuminated with purple lights. The theme this year is Together We Can. So acknowledging the grief and loss of those affected by overdose, as well as working to reduce stigma associated with opioid use disorders. Radio advertising started on the 19th and will run through the 31st on 3 separate local radio stations. There will also be vigils held at the Perk in Ashland, at Bad River Harm Reduction, and at the Nuji Center up in Red Cliff.
So
This is
I'll just-
Elizabeth from the community. Sorry.
go ahead.
Go ahead, Liz.
Is there any chance in the future to reach out to area businesses to see if there's any employees that are on staff for 8-hour periods that would like to be Narcan trained? I think about this often at Super One, somebody that would be on staff. You know, we work 6 to 8 hour shifts, and I know it's either us or Quick Trip that are getting a lot of traffic with the opiate users. Just to, you know, in the future to reach out to area businesses to see if they would be interested in that. And I would be probably really interested in that, being an employee there.
In the process of canvassing local businesses throughout Ashland, it's been a lot of boots on the ground, quite literally walking up and down the streets, going into the local businesses. We are still in the process of canvassing businesses. We've had a few delays in getting all of our signage posted and printed so we can get it distributed and posted. So it is still a work in progress on getting all of the materials out to the participating businesses. We have spoken to businesses if they're willing to participate, if they would like additional supplies for community members available, including Narcan on site or Narcan available for their staff, along with Narcan training. And through this process, I have actually scheduled Narcan training for a couple of businesses. One of the tattoo establishments in town actually does have Narcan on site, and all of their staff are trained. I did that training with them last week. So it is still a work in progress. I have a half part of Main Street to do yet, so.
Thank you, Liz.
Yep.
So as in conjunction with all the overdose, so with the upcoming overdose awareness, the International Overdose Awareness Day, the folks up at Tamarack, along with some assistance from the Essentia grant, put together these leave behind cards that I passed around to everybody. And this, I have a whole great big box of these for everybody in our department that does home visits, and especially home visits in situations where someone within the home has a substance abuse disorder. And you'll notice on the inside, there are all kinds of resources here for Bad River, Essentia, Essentia Clinic, Essentia Health Referral Line, North Lakes Community Clinics, Red Cliff Community Center, Tamarack Behavioral Health. There's drop-ins here. The Narcan stuff that Liz was talking about, the enzylazine test strips, other supplies. So that would be the vending machines that Liz has, so diligently got out into our community. Then we've got, Bad River, Health Department, Ashland Fire Department. And then on the back, there is a crisis line for, the Hope Line and the, Never Use Alone hotline. So these are great little things to have with you in your portfolio or notebook or whatever you're carrying, and when you leave, you just call the leave behind card, because you just drop it and there it goes. So, pretty cool.
Hot off the presses.
Yes, that happened to get dropped in my truck yesterday by my wife. Said, take these to work.
Any other questions or comments? We'll move on to children's unit update.
So my really big update is that, as you remember from last month's meeting, we talked about moving forward with filling my position because I will be retiring in January. And I think we told everybody that we had a really top-notch candidate, highly qualified. We have subsequently interviewed that candidate, offered the position, and that candidate has accepted. And the candidate is sitting right next to me. So Erica Pito will be taking over my role as the supervisor in the children's unit. I have the utmost confidence in Erica. She's got 21 years with the agency. She is a solid decision maker, excellent knowledge of the laws. And really does a great job with the staff. So I know that the unit's gonna be in great hands.
Thank you.
My next thing, I think I might have mentioned before, and now I have them. Through the Essentia grant, I was able to procure about $4,000 in funding to be able to get the Real Care infant simulators. This is a brand spanking new thing for us. They've been using these in the high schools in like the parent, I don't know if it's
I'm
parent
sure
education.
Laura could.
Yeah, Laura, you use these at Ashland High School? Thumbs up, thumbs down. Yeah, we used them at Ashland High School. Yeah, that's what I thought. Anyway, these are programmable little robots that you get them all charged. Turn them on, you can see that the head, you actually have to support the head and neck of the baby. The limbs actually articulate. Legs will twist and turn and things like that. You need to be able to change a diaper, console the baby, feed the baby. They come with a bottle that you can simulate that you're feeding. And then the baby will actually record data and internally as to how the individual participant is dealing with this child. So are they being attentive to the cues? Are they supporting the child's head properly? Are they just leaving the child in the car seat? So that car seat right there has a sensor in it that will, when I download it to the computer, it'll tell me how long the baby sat in the car seat. So we will use these to develop a baseline with parents of infants that we have had to take into custody. And then we'll be able to download the data, and that will show us what kind of educational curriculum that we need to take up with the parent for that parent to be able to safely parent an infant. So I'm really excited about these. Our family sports specialist is super excited about it. So really looking forward to digging into it and figuring it all out. They just came late Thursday afternoon. And I got them all unpacked and put into their little, almost looks like a coffin. It's kind of, but got them put into their storage container, we'll call it that. and got them all charged up, and now I just gotta download the software and read the book and figure out what I'm doing with them, so.
That's the worst thing.
It's gonna be interesting.
How many do we have?
We have 3 of them.
3. Oh, that'd be.
Yep, and then we also applied for the Family First Grant through the state of Wisconsin and got that. So we'll have another $4,000-ish to be able to basically, we're gonna get more car seats, more storage. And we'll be able to get some of the supplies that you need. They have parenting workbooks, and then they have a instruction book for the parent educator to be able to work with the parents on specific skills. They have extra bottles and extra diapers and extra, I mean, they come with a diaper,
Oh, okay.
yeah. And,
You're bleeding.
oh,
Do you realize that?
I did not realize that.
Don't.
I won't get it on my stuff. Then we got, a little onesie,
Oh, okay.
yeah, another one. And then, the participant will wear one of these little, wristbands that has a sensor on it. And you will assign this sensor to a specific person. So as the person is dealing with the baby picks up on who is actually doing what. So if the baby is being, basically parented by someone not wearing this wristband, we're gonna know. So it's a pretty cool thing. They come with diaper bags. Yeah, really neat.
Mhm.
So pretty excited.
This is not something you would do CPR practice on.
No. I hope not.
Might end up with a fail. I watched some soccer players try to practice soccer and watch their babies. They were not successful.
Yeah, it's kind of funny, Courtney, one of our workers had used a similar device like that, and when she was in high school. And went to a football game and passed the baby around to the other band members that were up in the stands. She failed. But she's turned out to be a great one.
I would agree.
Yes. And I believe that's all we have for now.
I think so too.
Yeah.
Okay. Then we'll move on to written materials.
The only thing I really wanted to point out that's a little different is you'll see resolutions in your packet. The intent was for these to come to this board first for approval to be forwarded to the full county board, but somebody jumped the gun and skipped us. And it might be because the timelines,
Yeah,
they
I
wanted to make sure they're done.
mean, I think Dan just put those on the county board agenda
Yeah, without
before
us.
they ever came here.
Yeah, yep, I think so.
So, that wasn't our intention. We didn't mean to pass over you, but, and hopefully in the future we'll get that cleared up so they don't. But anyway, these will go to the Wisconsin Counties Association for, supporting the white papers that they have for the budget and their request. Any questions on those? So
Sure.
George?
Do we want to ratify these in any case?
we don't really have it as an action.
Yeah.
Oh,
Joy,
What prompted I mean, not that I don't know there's a need for it, but what prompted a formal resolution?
I think it came from the Counties Association, didn't it?
Yeah.
I think it came from the Wisconsin Counties Association. They were asking all county boards to pass these
But-
resolutions.
It's a statewide movement.
It's,
Yeah.
yeah, and it's,
But the other piece of that is, it's the amount of time the sheriff's department spends transporting people to Winnebago when there's no beds locally is astronomical, and the costs associated with that and taking a deputy off the street. So having one closer when we need it, we'll obviously utilize our local services whenever available. But, a lot of northern rural counties just are experiencing the same thing. It takes so long. You have to wait for medical clearance, you have to find a bed. The deputy cannot leave them once the ED is initiated, or we basically lose custody of the situation. So, sometimes they don't really need somebody there, but we have to, or we lose the ID. So,
George?
There's apparent remodeling going on over at behavioral health. Do
Mhm.
we have insight as to what's? I
Is
think
that
we
what
talked
your
about
update
this
is gonna
maybe
be,
last
or-
meeting, I don't
Do you
remember.
want me to update now?
sure.
It might as well, as long as George asked the question, yeah.
Okay, so the inpatient unit is going through a remodel and we're wrapping things up with the first phase. So the first phase we did was 7 inpatient beds, that space, that also includes the acute care area. So what we did is we remodeled the nurses station, we expanded the outdoor patio space, we made the day room bigger. Did the roof, the HVAC of that section. So Monday, starting Monday, we'll start moving back into that 7-bed space. So hopefully Monday, Tuesday, we will increase our capacity to 7 inpatients. And then we will work on the 3 inpatient beds, that section of the building, and hopefully that'll be done within the next month or 2.
That section,
It will be done by, we were supposed to be moving in by August 26th, so
Oh.
everyone's frantically finishing up. On Friday, they're going to be doing some videotaping of the remodeled space. And so the timing of this meeting and that video didn't sync. However, that video will probably be on social media and probably their website. So between this meeting and the next meeting, you guys will actually be able to see the remodeled space. So they've been doing that so that they can show the board, so they can show the community, so they can show employees. It's just, there's such a tight turnaround window between, literally, they're gonna be cleaning all weekend, installing computers, moving everything over and trying to get people in spaces, Monday, Tuesday. So, we're moving as fast as we can get everyone going. So that's really good news, for that. And I know when I had brought this up a while ago, someone talked about bonding or something. What I had forgotten is, once upon a time, we were going to do a new wing of the hospital. And that was gonna be our behavioral health unit, and that's probably what they were talking about, bonding. But when the bids come in at $25-30 million, we just couldn't do that. So we have to remodel the building that we currently have, so we had no choice. And so that's, let's just say it's, don't quote me numbers, let's just say it's $5 million. So that we could handle that. Or, and plus, we did get a $1 million grant from, Janet Bewley. She gave $1 million specifically for, I know there was a press release and all that for that, specifically for the behavioral health project. So that helped a lot too. So we're remodeling the kitchen, we're remodeling some of the outpatient spaces too as well. You know, the roof goes over the whole entire building, but we're doing all the things that have to be done, as well as a few additional things, but most of it is just really wear and tear. And that's still $5 million. So, so yeah, everything's progressing. That'll be good news for the people that have to transport. And of course, respiratory illness doesn't help, because if we try to do medical clearance and that person's COVID positive, we have to transport somewhere else, or transfer them somewhere else if they need services right away.
So the inpatient is still only for adults, right?
Correct.
Okay.
We stopped
Yep.
the adolescent, and we won't be going back. There's just so much regulation that goes to the adolescent. And when you're doing the younger people, we just couldn't keep up, so. So there you go, there's your update.
Yeah. Any other questions? Children and adults in substitute care.
Here's a question. Do you want me to
Oh,
answer?
is there,
So if someone's COVID positive, it's not an automatic, depending on what they're there for. So for example, if someone's there for, detox and they need to be medically stable anyway, we might admit them to the med surg floor, because we have the capability to detox them and deal with their COVID, diagnosis. And then maybe once they've stabilized, we might be able to put them in the inpatient behavioral health unit. So it's not an automatic Winnebago transfer. Or let's say they come up COVID positive, and after medical clearance and assessment, it's deemed that the patient is, you know, they're maybe can go to a crisis bed, or they have other resources, or they're, you know, they're stable enough that they can be discharged and followed up with outpatient. then that might be the next step. If it is a mental health need where they need psych inpatient, and so that's gonna be that assessment based on the providers and whoever else makes that decision. If they're COVID positive and they still need the psych therapy sooner than later, then yes, we would. Winnebago, I just know has a COVID wing, so that I believe that's where the majority of them go. Does that answer your question, Tasha? Okay.
Any other questions? All right, now we'll move on to children and adults in substitute care.
So it's just the same report updated with most recent numbers. Nothing really unanticipated. We do have and have had one child in an out of state placement at the cost of $24,000.
Yeah,
Close to
roughly.
25, 24, but close to $24,000 a month. So. And that was after we exhausted every facility in Wisconsin, and this is not uncommon. So, that's driving some of this, but, we're really not too far off where we were last year, so.
The good news about that particular placement is that we are in the process now of trying to locate a treatment foster home back in Wisconsin. So that when she has made some adequate progress, we're able to get her much closer to home at a much reduced cost. So we're working on it.
And just to again inform you, or maybe for the first time for any new members, on the subsidized guardianship costs that are on the bottom here are actually fully funded now by the state, so that does not come out of our levy. And most of the kinship placement costs as well. Not all, but most. And then you can see on the flip side, the inpatient mental health costs and state mental health institutions, that would be our Winnebagos. And then the IMD placements, those are not as restrictive as inpatient mental health like Winnebago, but somebody still needs a locked unit, and so they would go to those locked units or more intensive services.
Any questions? We'll move on to economic support, income maintenance, performance reports.
I don't know if anybody's gonna have any questions regarding those, but just a quick rundown on the WEEP reports. So with that one, we've had so far, our heating season for WEEP is from October 1st of the fiscal year through September 30th. So we're still technically in last year's fiscal year. So far we have run 997 applications. And of course, we've assisted quite a few of the households. So we've gotten 877 households eligible for those benefits. This next year, we're hoping to get even more applications in. But we are wrapping up the WEEP season, so that is actually going to be getting wrapped up at the end of September. We're hoping to start our early applications starting in September for the next fiscal year. So that's our WEEP. And then the Northern Consortium report, which is one of the other reports on there, Tasha. I don't know if you're able to pick that up. So that one just goes through our basic numbers. It's the most recent information that we've received. All of the information on there is specifically for Ashland County residents. I did put in bold on the report, basically the totals, it's the average totals is what I mostly wanted everybody to pay attention to. Most of those reports for our healthcare benefits, including our Badger Care, EBD, which is elderly, blind, or disabled benefits, and some of the sub healthcare benefits through there. I just wanted to have everybody have a good idea as far as how many of our residents in Ashland County specifically are using those benefits. Thank you for trying, Tasha. So just something to keep in mind. I also have the food share benefits also for our Ashland County residents. And then there is the total. I think what is very important for our county and our economy as well is for the food share benefits, there is a specific dollar amount that our Ashland County residents receive. And there's like the total for the whole year so far. So I think that's a very big, impactful benefit for our county residents. Are there any questions about either of those two materials?
Doesn't look like it. Okay, thanks. In the written materials is the Woodside Executive Board meeting packet.
And that's just what you typically get every month with the minutes and the updates from DCF and DHS. So if you have any questions about any of that, you can let me know. Otherwise, it's just informational.
Move on to board member updates and possible agenda items. Anybody have any thoughts or suggestions?
Well, just something maybe it's pretty minor, but at the Land Conservation Committee meeting this morning, we forwarded a resolution for dark skies for Copper Falls State Park. And I was just wondering about whether there's an opinion among the professionals here, whether that's important to mental health or not. I just, like I say, it's pretty borderline kind of question, so now, there's no answer, I'm not too worried, but I just thought I'd mention it.
What is the resolution or dark sky?
Resolution Dark Skies is, it's an international movement to try to preserve dark skies where possible. So you could see the stars, you could see the northern lights, and it was mostly started around, observatories like in Arizona, those kind of places. But dark skies are maybe a tourist attraction. I just don't know whether they're a mental health significance or not. Just occurred to me that might be.
Helps me. I love being able to look at the stars and northern lights.
I'm not sure if there's a correlation or not, but we thankfully in Ashland County don't have a whole lot of light pollution, so you don't have to go too far to see those stars and wonderful northern lights.
Yeah.
Well, I think they make connect with public health too for the air pollution and.
Oh. I expecting my mental health, and Mary Jo Gingras, who lived out in the Pinocchis, showed me some amazing northern lights photographs that she had taken. And I haven't seen them in 20 years from my house, 5 miles south of town, because of the actual light bubble, so I'm distressed.
Oh.
Yeah,
Yeah.
yeah.
That would be a bummer.
The clouds left behind.
But one of the things I knew was that it says 80% of the people have never seen the Milky Way, so. Because of the light pollution. And the things on there.
I just kind of take that for granted because I.
Yeah.
Yeah,
up here, I look out the window and I.
Yeah, you live on the country,
Yeah. But I'm sure that is a huge tourist draw, like, I mean, I've had friends that I met not from here and come up and just go, oh my gosh, you can see the stars. And I'm like,
Yeah.
yeah.
Every night.
Can I just make a clarifying statement? We're going to record the video on Friday. It won't necessarily be available to everybody until maybe a week. Give them some time to edit. So don't start looking for the video on Friday. We're just got a team coming in with cameras and we got some voiceover and whatnot. So we're going to record the space on Friday, but when it's available to the public, I do not know.
And precisely where are we gonna look for it?
Probably social media would probably be your best bet, or the
That's pretty broad.
Tamarack Health Facebook page.
Oh, thank you.
They have a Facebook page. yeah.
They're gonna have an open house sometime?
No, we were trying, but because of the logistics of cleaning, moving patients in, and then how do you have an open house when you have patients in there?
Yeah,
Just
Yeah,
because of
yeah,
the
I suppose,
nature of the patients, that would be kind of disruptive.
Yeah.
So, we were trying to do something, but I mean, literally people are cleaning this weekend, so,
Yeah,
you know,
so,
patients
yeah.
in the door Monday, Tuesday, so.
And we appreciate that.
So we thought that was a better use of our time. We really wanted to do it because we really wanted to showcase what we're doing in the community and the board members. So that was kind of our compromise, is the kind of a virtual tour.
Mhm.
Because then more people can see it and you don't have to invade anyone's personal space, so. So look forward to it, but I just don't quote me as to when it's gonna come out, because I don't want marketing to get mad at me.
What you said.
I know, I get permission every time I look at your house.
the other, anything else from board members or?
Me back here.
Laura?
First, sorry. We couldn't get the tablet to hook up and I spent about 25 minutes trying to do that. And I thought, oh, my laptop's out in the van, so I went out there, battery was dead. Charger cord's at home, so that's why I'm late.
Love technology.
It wasn't even that, I guess technology didn't work, but then the next was like, oh, you didn't make sure your cord was in the bag, so. But, so sorry about that. Was there an update about like the Spark program and stuff that's happening with that? I've heard random things.
Well, so we just discussed the budget that was included in here, and there's an updated one. Does not include the Spark program, the BFI grant. But Pat Kinney and Dan Grady have both said if we get it, which we are applying for, that they will, if it's in time before the budget, they'll add it in, revise it. If it's after, they'll do an amendment.
All right, okay. So somebody said that they might not be renting space of the thing, and I'm like, okay, what's going on with that? So.
Yeah, we're very hopeful, but
It's a good program.
it is a
Yeah.
great program, but it's so expensive to run without the grant.
Yeah.
It's not likely to continue, so.
Yeah.
If in the event that ever does happen, we can be guaranteed that we will be looking for private benefactors and donors and different things. It might not be as robust as it currently is, because again, it's a very costly program. But you can see in Jerry's numbers.
Yeah.
That the delinquency rates have gone down, especially in the community, significantly. So it helps with crime, it helps with future, if you can stay out of the legal system as long as possible, you're on the right
Got a
path.
better chance.
Yeah. So it's got a lot of value.
Okay. So, again, sorry.
Anything else?
This is Elizabeth Brannick. Elizabeth
go ahead.
Frannis here. I'd like to hear if there's any update about the sober living request. Curtis Gothier was here, I think, last meeting and requested a amount to be budgeted for his program. Also, what else was I gonna say? Oh, I was wondering if there's any update on people that were receiving the services from the Hooves of Joy and seeing what is being replaced by that. I'm kind of worried about these left behind people in our community that benefited from this program. Thank you.
So
to start with your last question first, because it's fresh in my mind, we do have 2 providers of equine assisted therapy who have openings and can, it's been offered to all the children who used to have hopes of joy. Many of them have chosen not to take it, but the ones who have found it extremely beneficial and they really like it. So we do have that service available if people are willing to try another provider. And the first one was the sober living. So Dan and I just discussed briefly that that would be an appropriate thing for maybe some opioid settlement monies. But it is not included in our budget. So that's something full county board members could advocate for, but yeah, it's not in our budget because we didn't have the wiggle room to do that. However, we do fund, I think they need more of like a base allocation to really kind of get them through, because your census is going to vary from day to day, week to week. But we do have some funding sources that would pay for people to be in there. Our CCS program, for example, some of our substance abuse grant can go towards that. So we will assist them in that way whenever possible.
George?
Could we maybe have an agenda item at our next meeting where the parameters of that would be on a piece of paper that we could understand and therefore possibly take forward to the county board, because I wouldn't be able to, explain it.
Sure. The only caveat with that would be the way the opioid settlement is. The restrictions on it are not, you have to have some type of opioid use disorder. So it wouldn't be for alcohol or potentially methamphetamine, although most people who use meth oftentimes use opiates too. So it's just a very slim category, mostly alcohol, that wouldn't be able to go with sober living through opioid settlement funds.
Anybody else with any questions or comments?
How is the partnership with the sheriff's department going? These two are working together on?
Our partnership is wonderful, but we are running into some issues with the state. So we're meeting with them tomorrow. They had a meeting with law enforcement, and the same provider that the jail has is the provider for Vilas County. So they met with them today, and we will kind of get a recap of what they covered tomorrow when they come here. And I'll just briefly say, the grant that we wrote, we can implement as we wrote it. The state grant people want us to basically have, what did they call it, a gold star program. So they're changing a lot of different things. And there are the contract that we have with the provider. If we don't follow that contract and have an outside provider come in for those medications, the clause that indemnifies the county is null and void for any kind of things that might happen with those people. So it's not just as easy as a state saying, find a new provider. So we'll work that out. But our partnership with the sheriff's department is great.
Well, at least something's going
Anything else? Next meeting date is November 20th. Any other business? Adjournment is in order. We'll do that. Motion made and seconded to adjourn. All in favor?
Aye.
Hi.
Meeting adjourned. Just do that thought next time.
Yeah.
Do this in half the time. Kelly, was involved in school bus?
Yeah, that's what I know. Yeah.